Hello students, welcome to another session of healthcare management and hospital administration. As we were looking out for the various topics on health insurance, knowing what the health policies are, what does the health manager do, what were the health providers, what were the different health risk covered, and we're looking out for some CBHIs, that's community-based health initiatives, where we were looking out for some cost efficient techniques and some techniques to have the poor and the unemployed segments getting good health coverage. Now we'll have to see how these CBHIs or the community based initiatives for health or the community based health initiative be made reachable, because it is community based, and what we have to do is we have to make it reachable. So we have to do some efforts for social mobilization and strengthening of the people in the organization, because it is a social cause. It is going to definitely be affecting the era of the remote people and the lower class people. So we have to make them out to be reachable via social mobilization. We have to help the strengthening of the people around in the organization. We have to motivate them to work for this noble cause. We have to do a training of the women organization. The training of the women organization with the capacity building with special emphasis on the PRIs and the women's. So this happens to be a women driven organization, and it has to be centering itself amongst the training for the women. It is a demand driven social service. Because there is a demand, there is a rise, and we all know that 25% of our urban population still cannot be reached to. So there is a demand driven social service that is building up. There's building up of alliances and partnerships. There is a collaboration of the urban sector that wants to lend its helping hand to the rural sectors and have various alliances, so that the funds from the private sector starts coming to the remote and the urban sector, so that the poor can avail all the health policies. The most important part of CBHI being reached to is the development of the urban center via the insurance, and so the economic status of India also improves if this sector gets the benefits of insurance. Then there is advocacy for the pro-poor policies. This advocacy helps us to build in more and more policies for the poor people, so that even they can ensure their health, because as we stated before, health is a right to each and every individual. So now what we have to see is, how do we manage the process? How do we make this CBHI reachable, and how do we start with the process? What is the infrastructure that we need? What is the market changes that we need? Basically, we are going to look out for re-engineering. It's known as the business policy re-engineering technique. When we are going to re-engineer, we are going to create new systems so that the poor can reach, or the companies can reach the poor, and vice versa. So what we have to do is, first thing is we have to give it an appropriate market segmentation. We have to understand from the statistics point of view which segment of the society is going to need what. The urban is going to contribute to 75% and 25% is going to be the rural. So we are going to focus on the policies that would be made taking up the urban and the rural rural setups into mind. Then there should be initiative, there should be awareness of what we need to initiate, because if we lack an insight to initiate a program, it's going to be more and more difficult for the consumers to take your reform process. There should be product innovation and there should be incentives. There should be product innovations. Your policies are age old long, so your policies or your insurance factors should be innovating themselves with a lot of incentive factors in them, which is going to help the infrastructure market to be strong, and that is going to place us into a good background of an economy. Then we have to have specialist health insurance companies, so that these companies can have an easy entry norms for them to come in the market. Now, what are we understanding from this is that we've already done a market segmentation. Now, once we have understood our market segmentation in an urban setup, we always know that there are a lot of different types of diseases and there is a lot of want for the insurance. So we have to make the specialist health insurance a very easy norm so that they can come into the market, they can enter the market, and they can prove their policies to be beneficial to people who want to enroll for it. Then we can use a provider rating and credentiality. How much original is the infrastructure? How much is the rating that the market is giving to the policy? We can have a rating and a reporting for this so that the provider can be into the market at a competitive level and should be into the market on his credentials so that there is no bias coming into these things. We can have a centralized database for health insurance experience statistics. So as that's what I was saying, that whenever we are going to re-engineer or restructure something, we need a centralized database. So here the centralized database is going to help us into the experience statistics, because this experience statistics is going to keep the data coming in, and we can definitely compare the existing data, that is the retrospective data, to the prospective data, so as to understand where the provider lies and what ranking is the provider there for. Then we need to have an efficient back office support for underwriting and claims processing. Now this back office support plays a very important role for an insurance company, because efficient and a suitable back office support helps us to helps us to maintain our database, helps us to keep the papers in the order for an underwriting. It is an underwriting process, it's not a medical writing. So it's an underwriting process that is going to help us to keep the papers for the providers efficient, to keep the databases for the providers efficient. And since there is a good database and there is a good processing, this is going to definitely improve our market chances with a very good infrastructure facility. So if we go to a conclusion, as what we are keeping on seeing what the health insurance is, that we understand that health insurance is emerging. It's not completely emerged, it is still emerging to be a very important financial tool for the healthcare of the people. People have started understanding in India what is the importance of having a medical insurance for themselves, which is the most important part, as we say that the disease never comes on its own time. It can be, it would be a surprise, it could be a dramatic thing, and it could change the life. So the illness and the sickness, it is not a tragedy, but it is a situation in one's life. So what has happened is the Indian population is getting more and more aware of the emerging trends into the insurance companies, and they're understanding that why is it necessary to be having a healthcare insurance to each and every individual for security. So what we would say is this community based health insurance is emerging. So since it is just emerging, it should be further explored so that the disadvantaged sections should get a maximum benefit. Now, since we are just emerging, what are we trying to do is that we are trying to get the disadvantaged section, that is the poorer sections, or that is people who cannot reach up to these insurance, to be exploring themselves so that the providers can reach this lower class section, so that our economy gets the maximum benefit by providing good healthcare needs and insurance to the urban or the poorer section or the disadvantaged section. So in now the present scenario is that we don't have a pan-India model of the health insurance. So all different forms of health insurance need to be explored. Now there is this pan-India model that is being used universally, which definitely categorizes which healthcare insurance is suited best to the lower or the middle or the higher income groups. And this is an absence that is there in India. So we need to have different forms of the society, the demographics, the population, the census, and we need to devise different forms that can be suited to these people so as to enjoy maximum